So many of the patients that I see with Parkinson's disease are depressed. And the question then arises, what can we do about their depression? And the answer is there are a lot of things that we can do. The important thing is for either the patient or the physician to recognize that depression is a problem. That's the greatest problem then to treating the patient. Once the disorder is recognized, there are many things, as I say, that we can do, and they include, for example, various medications, various antidepressants. Now, there are antidepressants that have been used for many years, and they are known to be effective in people with Parkinson's disease who are depressed in helping the depression. There are other medications that have been developed more recently, and there are a number of different types of medication that have been developed over the last 25 years, something of that order. And these medications are also very effective in treating the depression of Parkinson's disease. The issue with all these antidepressant medications is that they don't work instantly. So when we start a patient on medication, there's going to be a delay before the treatment will kick in. And there's no one dose of any particular medication that fits everyone. So that the typical approach would be for us to start a patient on a small dose of the selected antidepressant and then gradually build that dose up until there's a beneficial response. And in some cases there may not be a beneficial response to one particular medication, in which case we would withdraw that medication and try another. But it would generally be our belief that patients would be helped by antidepressant medication if they're patient enough to let the medication work, and that may take then several months, getting up to the right dose gradually and allowing time for that dose to be effective. Now, in addition to medication, there are other things that we can do. Meeting, for example, regularly with a psychotherapist, who could be a psychologist or a psychiatrist, can be very valuable in helping patients with depression. And the combination of such meetings for psychotherapy and taking medication is generally more effective than one or the other approach alone. So that would be a second approach to treatment. Another approach is to really keep people very active. Now, the problem is that when patients are depressed, they don't want to be active. They want to be left alone, and they will sit there ruminating and worrying about life. But if they can be encouraged to be active, if they can go out to the gym every day or go for a brisk walk for an hour or so a day, that is really very helpful in helping depression. Some of the medications that we use for Parkinson's disease, the so-called dopamine agonists, may also possibly have an antidepressant effect. And that's an issue that's under study, has been for some time, and I can't really be very definite about that. There are other more extreme treatments that we sometimes have to resort to in people who are severely depressed, but those are not really required in almost every instance of patients who have Parkinson's disease. I think the main message that I'm trying to get across then is that there are very effective treatments for depression, and the only problem really is knowing when to prescribe or give those treatments. And that's really then a matter of coming up with the correct diagnosis. And that depends a lot upon your relation with the physician, so that there is a frank exchange of views, a discussion of problems and so on, so that the physician or your healthcare provider knows best how to help you, because the physician recognizes the problem underlying your concerns.